First of all, I'm really delighted that mental health disorders are in fact included within the whole ambit of the Center for Control of Chronic Conditions, because mental disorders tend to be chronic conditions themselves and they often co-occur with other chronic conditions. So I'm hoping very much that mental disorders will be treated on par with other disorders like cardiovascular disease and diabetes in thinking about the causes of these conditions and also in planning for the interventions for these conditions. The London School of Hygiene and Tropical Medicine has been a long-standing partner of institutions in India, going back almost to its own foundation. Its early work was primarily in infectious diseases and later on in health systems. And its work on chronic diseases has been more recent over the last 15-20 years. We worked with eye diseases, with diabetes, heart disease, and my own particular program on mental illness is now nearly 20 years old. This new partnership really reflects our commitment to that particular history, to continue to commit to working with Indian institutions in partnership with, of course, both the All Indian Institute of Medical Sciences and PHFI, to promote research and capacity development in chronic diseases. We need to put into action what we know already works. So, for example, we need to implement some of those evidence-based interventions for mental health problems in the real world. And actually, we are doing that, for example, with the government of Madhya Pradesh through the PRIME program. But it's also fair to say that we need to continue to generate new knowledge about the particular causes, the social determinants and other factors that lead to mental health problems in the Indian context, and to develop interventions that are culturally appropriate and which can be delivered by community-based workers and other non-specialist health workers. You're absolutely correct to point out that suicide is now one of the leading causes of death in young adults in India, and this is a matter of grave concern. I think the first and most important thing is to recognize this as a public health crisis, which till date has not been done. I think the next step is to institute the evidence-based interventions that we know can help reduce the burden of suicide. For example, limiting access to lethal means such as pesticides, which are the leading cause of death due to suicide. The next is to actually put into place interventions that can promote resilience and mental health in young people, for example, through life skills programs in secondary schools. And finally, to improve access to interventions for young people who have got mental health problems, like, for example, depression, through primary care mental health services. But I also would like to emphasize we need more research, more science to understand why are young people killing themselves in such large numbers in India. And I'm afraid at the moment we do not have a very good understanding of that. I must first disclose a conflict of interest because I was a member of the Ministry of Health's mental health policy group, so I was involved with drafting the national mental health policy. So clearly I believe it is a very good policy. It's a very progressive policy, and by progressive I mean that it really enshrines the right to care for people with mental illness and the right to a life with dignity and free of discrimination. I think to really implement this I think very progressive policy, we are going to need additional resources for a district level mental health care program that provides for community-oriented mental health care, particularly for those individuals with serious mental illness who often face some of the most serious kinds of discrimination and human rights abuses. Certainly, I would think that being partnered with conditions like hypertension, cancer and diabetes can be very useful to reduce the stigma associated with mental illness. It can certainly help a lot in enhancing the importance of mental illness in the public eye. But equally, I think recognizing that mental illness affects every family in this country. And I'm very pleased to see, for example, recently that celebrities like Deepika Padukone have, as it were, come out and disclosed their own struggles with mental illnesses like depression. I think having very prominent voices like hers talking about their own mental illness can do great things to reduce the stigma associated with the mental illness. It's very unfortunate what happened. It's a tragedy, but the bigger tragedy would be to associate mental illness with such tragedies. Mental illness is extremely common. These tragedies are exquisitely rare, and it is a pure statistical chance that in fact that particular pilot had a mental health problem. Probably thousands of pilots with mental health problems fly planes every day without any harm coming to any of the passengers. What happened on that plane, I can never tell. But I can tell you for sure that the association between mental illness and this kind of random event is extremely rare. It's, as I said, a statistical chance.